All right. So, good evening, everyone. Welcome to week three with regards to decoding your food discovery map. Last or 2 weeks ago, or in the last module, we were talking about the food discovery map and sort of how we wanted you to use it. And so, today we're going to review that and sort of how do you glean information from that to be useful moving into your progress here with Arthritis VIP. So again, today the presentation will be myself and Dr. Hawass. I'm a naturopathic doctor. I practice in Ontario. And Dr. Mark Hawass, well, you know who that is because you've been working with him all this time.
Yeah, so just in case for those people who doesn't know me, I specialize in chronic pain and arthritis. And so what we do at Arthritis VIP is try to help people overcome their arthritis or chronic pain through natural ways. We utilize educational guidance about what to eat and what to exercise and how do you change your habits. And at the same time, what we do in terms of procedure wise, we do infusion therapy, supplements, and PRP treatments. Yeah, so I'll let you go ahead, Crystal, with this presentation today.
Yeah, so for tonight, we really want to focus on the importance of hydration and the leaky gut. And so, Mark, if you're able to pull the screen down to the slide number 4.
That's the one.
I can't see it on the screen. So I can see that you're on the first two.
You want the diagram?
Or if you can just progress the slide.
So this is the diagram. You can see that, no?
No.
The images, right?
Yeah, so on the actual PowerPoint slide, it would be slide number 4.
Yeah, I have it. It's right there now.
It's not showing up on the share screen.
Okay, maybe I have you on. How about now?
Okay, great. So if you can go back. Amazing. So with regards to the importance of hydration, so we'll get you to go over one more screen. Beautiful. So something as simple as water, we're made 70% of water. And I think a lot of us, including myself, tend to take it for granted. And we just kind of say, oh, it's okay if I'm running a little dehydrated, it doesn't matter. But it plays such a vital role. So specifically with regards to patients who are coming to Arthritis VIP, water essentially lubricates your joints. So if you're dealing with arthritis, and if you're not doing something simple as drinking enough water throughout the day, then you're going to have creaky, achy joints. Keeping properly hydrated will also help to reduce your likelihood of getting infected. So, when you're hydrated, your eyes and your nose and your mouth stay nice and moist. And so these are areas that viruses and bacteria like to kind of attack essentially. And when those areas are really hydrated well, you're flushing it out of your system so that you reduce your risk of getting sick. It also, with regards to water, delivers nutrients to the cells. Your cells can communicate far more effectively when they're properly hydrated and not shriveled up and dehydrated. And then also keeping your mind sharp. Like I have multiple patients who will come in and they say, I suffer from headaches 2-3 times a week. And it can be pretty debilitating. And I always take Advil and it seems to keep it at bay. And so with the majority of those people, I oftentimes tell them before you reach for the Advil, go ahead and drink 500 mils of water and wait 20 minutes. And if it improves the headache, fantastic. You've now just proven to yourself that the headache was due to dehydration and not due to a deficiency in Advil. And then sometimes, if that headache persists, then I say by all means, go ahead, reach that Advil. If you've listened to some of our original, I think it was in week 1, we talked about when you take NSAIDs or what's known as over-the-counter pain medication, Taking one of those can change your gut microbiome for up to 24 hours. So, if you can avoid a lot of your concerns with regards to just making sure you're hydrated well, you're doing your body a whole lot of good.
Yeah, that's
So,
awesome. Just to reiterate, or basically, I love that concept with lubricating the joint. So what we occasionally do to help the joint and basically do traction. So basically pull the joints apart. And even if you have chronic pain, not necessarily related to joint, so basically when you open that area, you're stretching it out. So you're forcing water to go in. But if you're dehydrated and you don't have enough water, that traction won't add much. And the other part is all of our body, as we said, it's made out of water, but the communication between all the cells is through electrolytes. And if those electrolytes are kind of condensed, they might not have the right proper signal to communicate with each other. That's why we need that water as a medium to communicate between the cells. And the last part is there's two parts to well, technically three parts of dehydration. The joint dehydration, that's one. The second part will be the gut dehydration, and then the overall dehydration, what just Crystal mentioned about the headache and so forth. So yeah, you can take it at multiple levels. And one of the stuff that we may be talking about today is about the gut dehydration as well.
actually, you've done a perfect segue into the next slide, Mark, with regards to this image that we've shown. I think it was in week 1 or week 2. So if you want to sort of, I loved your explanation as to how you talk about the sort of the relationship from what we see in nature to what's actually happening internally.
Yeah, so I view the gut as like a coral reef. There's those anemones in the coral reef, and they represent our gut villi. And basically, that's where the magic happens in terms of the immune system. That's the mucus around all those villi that prevents all the bacteria from coming. But if we get dehydrated, that mucus gets weaker or cracked, and that's when bacteria gets in. And then once we get into trouble with inflammation, upset stomach, generalized weakness, and that leaky gut syndrome is kind of endless with in terms of what happens next if you continue to have that. So one of the things is let's hydrate that gut or the villi and restore that mucus lining. And I guess Crystal is going to tell us how to do that. And that's what I'll pass it on back to you.
Yeah. So on the next slide, essentially the sort of the definition of the leaky gut, essentially, again, imagine that the intestines or that microvilli in the picture that you saw are these finger-like projections that essentially grab onto the nutrition that you are putting into the body. But if they're dehydrated, if they're damaged, they're going to create gaps in those finger-like projections. And that's what allows the bacteria and other toxins to pass into the bloodstream, which essentially then creates inflammation throughout the body. And for some people, that inflammation manifests in, irritation or inflammation at the joint area. So it's important to remember that every time you eat or drink, you're either feeding disease or you're fighting it. And so on the next slide, you'll see that quote, and we had posted it on the previous module, because it really is true. Like you have so much power in what you can and what you can do with your body and the results that you can get from your body by literally feeding it information. So what you put in is what you can get out. And so that was the whole purpose of us doing that food discovery map. So on the next slide, yeah, if you can go forward just one more, amazing. We had discussed about sort of how to use the food discovery map, and that we would get you to do 2 weekdays of your choice and then 1 of the weekends. And it's essentially just to get a snapshot as to what are you consuming, the time of day, and what's your hydration level. And this will provide us with some really good feedback in terms of how we're going to decode that information. So Mark, I don't know if you wanted to mention anything with regards to that sort of gleaning information from that map.
The most important part is not collecting the data, is the aha moment when you see that information, when
Right.
you do your homework yourself. So the intention of it is not to criticize, and I don't want you to kind of try to be good and adherent to what a good diet look like. It's basically, this is discovering your own. There's no judgment to it. Basically, you need to figure out, am I doing the right thing or not? So you got to be honest with yourself and literally chart out whatever you're eating and the time that you ate. The intention of this, once you fill it up, is we're going to ask you to go and get the calories and the macros of it. But as far so far, if you guys didn't do it yet, we'll hold on maybe till the next session.
Yes, absolutely. And I think that's a really good point that you brought up, Mark, with regards to you're doing this not for us, you're actually doing this for yourself so that you can start to glean information from it and maybe realize like, whoo, like I didn't do too hot with my hydration. And so that's something I might want to look at. Or maybe it's something where you're noticing you're not eating enough. So there are lots of different information and aha moments that you can glean from it. And so the hope or the intention is that once you kind of have a snapshot of what a week looks like for you, you can take actions to improve that. And again, it's coming from a place of non-judgment, but it's coming from a place to get you motivated so that you can start to really get the benefits from the work that Dr. Hawass is doing with you at the clinic. So part of the biggest next steps that we ask everyone to do is no matter how much vegetables you seem to be eating per day, if you can increase that by 1 serving a day. And so 1 serving looks like 1 cup or 1 closed fist. And on the next slide here, I've provided you with a list of some of those high value vegetables. And if you do want a, like you can take a screenshot of this so you can have it on your phone. Or if you'd like a list directly, just connect with somebody at Arthritis VIP and they'll be able to send this list to you directly. But the purpose of these vegetables is that they have been shown with regards to science and research to really have the highest value of antioxidants, of fiber, of phytochemicals, to have a positive impact on your hormones and decreasing inflammation. So I get patients to kind of glean at the list, and if there's a vegetable there that they have never heard or they're a little bit curious about, I challenge them and I say, okay, this week, maybe it's collard greens. Go ahead, pick up a collard green, find a recipe, learn how to cook with it, and try it this week. You don't have to love every vegetable, but we do want to challenge you to really start to incorporate a variety of these things. Again, all these different vegetables provide, you can think of it as sort of data or health information that your body can use to basically get the end result that you're hoping for. In a utopian world, I would love for everyone on this planet to have 6 servings of high value vegetables every single day. Realistically, and I'm a naturopathic doctor for the last 10 plus years, I probably average on a good week, maybe 4 vegetables a week, or sorry, 4 vegetables a day. My average is usually between like 2 to 3. And again, it's not coming from a place of judgment. It's just that like some weeks are great, some weeks are not so great. But I always come back to this list to try and say, okay, you know what, this week I've had a lot of cauliflower broccoli. I need to spice things up. And so I'm going to incorporate some escarole and some okra this week. Again, variety is super key here.
Yeah, so 2 points that I'd like to mention here. Those are raw, not cooked, because some people kind of get scared if they cook them, they kind of shrivel, and then the volume will increase. What's your point on that?
So a lot of these vegetables, especially when we talk about the broccoli, cauliflower, Brussels sprouts, they and cabbage as well, they should be lightly cooked.
No,
And the reason,
sorry, what I meant when they do the serving, it's before they cook them.
it's actually after it's been cooked.
Exactly. So just wanted to clarify that. So after you cook the stuff, that's when you measure your serving.
Yeah. So everybody knows that when you have spinach, you can have like, you know, a big pot of spinach, but once you cook it, it shrivels down to like a handful. But you will also notice spinach is not on the list because, again, it just doesn't provide you with the same punch as some of these other vegetables would.
Yeah, and the other point you mentioned it about it's you got to be crunchy, a little bit, kind of half cooked, so it's not overcooked.
Absolutely.
Yes, and one last thing, and I tell my kids really this is, you don't know that you don't like something unless you really try it.
Hmm.
So even if you have some stuff here on the list that you don't know, trying even once is not enough, because maybe you picked up the wrong, let's say you picked up okra and you didn't know how to cherry pick those okra, and maybe they were not the best kind, right? So you're gonna try it 2 or 3 times, cook it 2 or 3 different methods, and if you like it, that's awesome. If you don't like it, just move on to the next item. From that list, you might find 4 or 5, 6 different things that you like, and yeah, you might stick with that. And some of the stuff that you kind of borderline, you might add it once a week or so. But as Crystal said, yeah, variety is very critical. I personally probably I incorporate 7 or 8 of those on a weekly basis, and yeah, you get used to it after a while. It was hard to me because I do probably 7 to 8 serving a day, and
Yeah,
it's really hard at the beginning. You feel like you're munching all day long, but you feel good.
definitely. And a trick that I like to use, and this is what I did with myself initially, was because I have a South American background and rice is part of our diet, breakfast, lunch, and dinner. And so what I did was I would cut the amount of rice that I would have by half, and then I would chop up some broccoli and cauliflower, and I'd put that at the base, and then I would put the hot cooked rice over top of it, and then my curry or whatever else I would eat with it. And the heat from that food would essentially cook the broccoli and cauliflower to the point where it was still crunchy, but there was a little bit of heat action to help sort of break it down. And it's a really easy, clever way to get your veggies in, but and also feel full. Because sometimes for some people, if they're eating just strictly lots of rice and then they decide to like cut it out altogether, there's a lack of feeling satisfied after eating. So you don't have to give up anything. It's just sort of like, how can you navigate being a little bit better and improving it? And so doing half rice, excuse me, half vegetable. Same thing with regards to arugula. I would put that as the base of anything that I eat. So if I'm having again rice with something else, arugula goes first, then my rice, and then everything else on top. You really don't notice that. It does. And actually, arugula is beautiful with any pasta that you decide to have as well.
Another point I'd like to mention is, um, don't deep fry that stuff like the
Right.
cauliflower, yeah, and don't bread it, because you're gonna kill the whole concept of
Yeah.
trying to reduce inflammation. So no breaded, no deep fried. And you mentioned the rice, and 2 weeks ago, the last session, we talked about cooling the
Yes.
the roti or like even the grains and eat them the following day, just to help reduce the insulin spike. Can
Yes.
you mention that again, please?
Yeah, so what Mark was talking about was essentially taking potatoes and rice and turning them into a resistant starch. And how that happens is you cook your rice or you cook your potatoes as you normally would, and then you would cool it ideally in the fridge for 24 hours. And then after 24 hours, you reheat it. And that process of cooking and cooling turns that food into what's called a resistant starch. And all that means is your body can't break it down the same way as it would if it was eaten fresh. And so as a result, it doesn't spike your blood sugar levels as high as eating rice that was freshly cooked. So a really simple way that you can sort of incorporate that resistant starch aspect is cook a big batch on, let's say, Sunday, enough to last you 3 to 4 days. And then you use that throughout the week. And now you're consuming something that is far healthier for your gut microbiome, better for your blood sugar levels. and you can incorporate multiple different ways into your diet.
Awesome.
Yeah. And then you also feel like you're not losing out on eating your rice or your potatoes. So this was a concept that really hit home to me when I was in my university days, which is a very long time ago. But the concept of limit drinking your calories. So when I was in university, oh my God, I would have a medium cup of coffee from Tim Hortons with 6 sugars and 2 milks. And you can see on the list that a medium double double has 14 grams of sugar. So I can't even imagine how much sugar I was consuming. But what I was doing in university is I would have one of those and then I would go sleep in a cubicle for 45 minutes, wake up to a pool of my drool, and then continue to study for maybe an hour and then go back again and get another coffee because I was exhausted the entire time. On top of being tired all the time, my anxiety levels were spiking through the roof because I kept having all this caffeine, but I had also gained 5 pounds just in that first year, just because I was consuming that sort of coffee intake. And so if you look down the list here with regards to, a can of Coke is going to be about 11 grams of sugar. A grande frappuccino from Starbucks, like that's a whopping 45 grams of sugar. It's pretty wild how much sugar can be contained in things. If you get a fruit smoothie from places like Booster Juice, or I'm not sure of the other sort of smoothie places, but you can see that even though the intention is good to have a lot of fruits in your diet, you're giving your body a whole whacking dose of 30 to 60 grams of sugar. And sugar, and I also put here the calorie list, and the calories are important if you're trying to lose weight, but the sugar piece I want you to be mindful of because sugar drives inflammation in the body. It drives a lot of dysfunction. And if we can get you to be clever with reducing the amount of sugar in your diet, you're really going to get some really big impacts in your health overall.
It does not mean you eliminate sugar, but if you're gonna have to have the sugar, I would limit it to roughly all carbohydrate to about 100 to 150 grams per day. I feel that's better than kind of restricting it completely and going to what people call it as a keto diet. So
Yeah.
more low carb diet, and whatever you eat that is going to become from a sugar base will be more of a complex carbohydrate, like a sweet potato, anything that has a shell to it. So basically, when you eat that, you'll have this sweetness part, but it's going to take a while for it to digest, so you don't have that sugary spike. And even if you like that can of Coke or you like that smoothie, maybe just have a small amount of it. All right.
Exactly.
It's not, you don't have to have an extra large one. You have to finish it. So even when you say that double double, you could have taken the double out and put maybe one sugar that will be 7 or 8 grams. Then you're going to be okay with that. But if you do it all the time, that's when it's going to catch up with you, and it's going to be too much sugar, too much inflammation, and it will take 3-4 days for that sugar spike to come down.
Yeah.
Interestingly enough, they did this study on seniors that live in assisted living and nursing homes. They gave them a cookie which has 70 calories. 70 calories, roughly, we're talking about less than 10 to 12 grams of sugar. They were able to walk it off within 2 to 3 hours in terms of burning the calorie. However, that insulin spike stayed in their body for 3 days. So imagine as we grow older, that sensitivity for insulin to bring the sugar inside is not going to be as efficient. And that sugar that start roaming around, it's basically going to cause more inflammation through joints, muscle, tendons, ligaments. And that's the hallmark of chronic pain and inflammation.
Yep, absolutely. And, when I went from drinking, 3 medium coffees that had 6 sugars in it, I didn't take it out of my diet overnight, and just went cold turkey. In fact, if I did that, I probably would have had migraines for a week. What I ended up doing was I actually did something similar what Dr. Hawass or Mark just mentioned was I went 1 week and I said, okay, I'm going to have 6 milks and 2 sugars. So I switched the ratio around. And then I eventually started to cut back the amount of milks, cut back the amount of sugars. And I did that over the course of like several months until by about the 6 month mark, I went down to just having one black coffee a day. And so you can see that took a long period of time, but it was also sustainable because now I'm approaching my 40s and I only drink, like now I drink half decaf, half black. And that's what I consume. There's no need for me to have sugar in my coffees anymore. Because also over time, your taste buds become accommodated to like what normal amounts of sugar taste like. And so if you have too much of it, you start to then realize like, ooh, my body's not feeling the way how it used to be feeling, or ooh, that's really sweet, I'm not going to have too much of that. So in terms of the next steps, we really want you to do your best to focus on limiting processed foods. So if you see in this picture here, you'll see that, if you feel like you want to have like that granola bar, maybe reach for a hand of like a handful of mixed nuts, seeds, and some dried fruit. With regards to, avoiding how much deli meat you're consuming, because those typically are high in nitrates and salt. And if you can basically batch cook a bunch of, turkey breasts or chicken breasts and then slice that to make sandwiches, you're actually having real food. One of the worst things you can possibly do is those fruit cups. I mean, they are so crazily high in sugar, and they're at that point there's just no nutritional value left into that. So grab a couple clementines. You can actually eat more clementines and get the same amount of sugar compared to one of those fruit cups. And then when it comes to your breads, definitely staying away from things that are white and processed. They're kind of stripped of that nutritional value. And when they're stripped with that nutritional value, immediately you get that sense of satisfaction, like, ooh, that tastes so good in my mouth. But oftentimes you'll notice an hour, 2 hours later, you're feeling quite hungry and you want to eat something else. And that's where overeating comes into play. So it's making those small, simple switches will give you long, sustainable changes. And I think that's where you can start to see shifts and changes when you do that food discovery map, when you start to get those, a bigger picture as to what you're putting into your body on a daily basis.
I love that concept. Just want to add one point. Don't do them all at once. Just take one thing every week. If there's 5 or 6 items on that discovery map that you want to change, even if it took you 2 to 3 months to perfect it, that's totally fine. Otherwise, you're going to be more rebellious and go back to your old habits. So if you want to cut the cold cuts and just go to fresh meat, just do that for a week or two and leave the rest of it as is. And don't feel guilty about it. Don't feel bad about it. And as you progress and you change one aspect and you kind of more becomes a building block, and from it, you go further and further to improve your list as you go.
Yeah. And I love that you mentioned that, because that's where your change becomes sustainable, that it carries you through your entire life, not just for 30 days, right? Like that's super important. Now, the other things are deep fried foods. And so these, man, if you wanted the fastest way, in my opinion, anyways, that I've seen in clinic to cut pain and inflammation out of your diet, it's avoiding these pro-inflammatory oils. So things like corn oil, cottonseed oil, grapeseed oil, sunflower sapphire oil, safflower oil, and vegetable oil. I would even argue to an extent palm oil would be another one. And trust me, if you start reading the ingredients in packaged foods, you'll see that they're either packed with palm oil, vegetable oil, sunflower oil, canola oil. And I actually forgot to put canola oil on the list, but that's definitely a big offender as well. These oils are all high in what's known as your omega-6s. And these literally metabolically drive inflammation in the body. And if you're coming to Arthritis VIP to get injections to reduce the pain and reduce the inflammation and help rebuild cartilage, and you're not eliminating these deep fried foods or foods that have these oils in it, you're not doing yourself any favors. You're going to feel immediate improvements, but you're not going to get the long lasting results that you're hoping for. And if there's one thing I hope anyone can take away from what we're talking about is avoid these oils. So then the question then becomes, well, what the hell can I consume when it comes to oils? And I tell patients things like butter, ghee, olive oil, coconut oil, avocado oil. Those are the 5 things that are safest to consume and cook with. And what's beautiful now is that on the market, there are lots of, like, if you want to have a handful of potato chips, they now make potato chips that are fried in avocado oil. You just got to look for it. So there's a lot of options that exist. Again, having it in moderation and making sure you're doing your best to minimize consumption of these oils here on the list.
Yeah, so that concept of having deep fried stuff to me is a no-no, regardless if it's a good oil or bad oil. Well, bad oil is double jeopardy for sure, but when
Yeah.
it's a good oil, the problem with it, the amount of calories that you're going to consume is humongous. So a small or medium potato will be about 200 calories. Once you deep fry it, it goes up to 900 calories. And because that oil, regardless if it's healthy or not healthy, is going to be soaked in the potato, and now you're going to have extra calories for no reason. And what we're trying to do with any chronic pain patient and arthritis patient is to reduce weight, not because of just the pressure on the joints, also to help reduce the resistance to the inflammatory markers. Because when we have a little bit of extra fat here and there, the body will be resistant to all the healing properties. So does that mean you're going to avoid those the rest of your life? I would say no, but that moderation part with the healthy part becomes later. But right now, if you're on the journey to suppress that level of inflammation, you want to do whatever it takes. So just basically don't have any deep fried foods.
Yeah.
And if you do that for a couple of months and then reintroduce it with the good stuff that Crystal mentioned, then that's awesome. But it's going to be occasional here and there. But you cannot start a maintenance habit without doing a jump start first. You got to jump start, clean up your body, clean up your pantry, and then in the future, if you want to dabble with it here and there, that's okay.
Yeah. And if you notice, like I mentioned again, if you start reading the ingredients in a lot of packaged goods, you'll see that those oils are there. And if you put that down, you'll start to notice that your grocery, like, you're going to be shopping more from the produce section than you will be from the inside parts of the grocery store, because you can control what you cook and what you prepare. You can't control what comes in a package, right? So yeah, so I think those are really great points.
Yeah.
Now, in term,
sorry, I'm glad to mention this. So if you imagine the screen is a supermarket, most people are going to have an issue with doing shopping and don't know what's healthy, what not healthy. And the easiest way is say, just do the a U shape around the perimeter of the supermarket. On the right hand side, usually you have your produce. On the back end, you're going to have all your meats, and then you're going to have some of the dairy stuff that you might pick up. But literally, if you avoid the center shelves for occasional stuff, if you want to pick up the rice, pick up the oils, but anything processed you can avoid. So your shopping list will be really quick and you're in and out within 20, 25 minutes, you're outside the supermarket. You don't need to spend hours trying to read labels because mainly it's going to be the produce and vegetables and fruits and the meat around you, right?
yeah. And if honestly, if you are still feeling lost after today, most grocery stores, so places like Metro, Longos, and I know for a fact Superstore and Loblaws, those grocery stores, they have dietitians where if you call ahead, they will for free give you a sort of tour of what's the best way to eat for a healthy long life. And like the Coles Note version is exactly what Dr. Hawass said, which is essentially shop the perimeter of the grocery store. But if you feel like you need more of a hands-on, most of those grocery stores with no charge will provide that service for you. So now moving on to the VIP method of what we do while you are going through the process with us, we put you on something called GI Revive, which is a powder that essentially repairs and restores the gut lining integrity. And so again, going back to the picture with regard to the microvilli, which are these finger-like projections that are absorbing nutrition. And if there's been inflammation or irritation to the gut lining, they become swollen and flattened. And what this product does is it actually helps to restore the integrity of that. So those finger-like projections become nice and tall, and the gaps are now filled in and they become strong. So they prevent any toxins from leaving the intestines and going out into the bloodstream. It also helps to decrease inflammation of the gut lining. So, you know, it's something to remember with regards to this particular product is that there are soluble and insoluble fibers. And all that essentially means is that some of the fibers will dissolve in water, some of them won't. So when you mix this product with water, you'll notice that you can stir it till kingdom come and it doesn't blend 100%. And that's nothing wrong with the product. It just means that you just have to stir, swallow it, and kind of get it down the gullet, if you will. But it's really sort of an integral part to, in addition to eliminating a lot of the things that cause that irritation, we can now do something to relieve and restore the digestive system. And so here, again, we had mentioned this on our last module that improving your life doesn't have to be about changing everything. And I think Dr. Hawass had mentioned that, you know, that's the key. Like if you try and change everything, you're going to feel overwhelmed. But if you can make those changes that count, you will be getting that sustainable, life-changing, life-altering impacts. And then lastly here, which we put on every one of our presentations, the 3 things or 3 aspects or 3 stressors that really contribute to the intensity of arthritis and the creation of arthritis. So again, your physical stressors, your chemical stressors, and the emotional stressors.
Yeah, so all what we talked about today, or we've been talking about the last couple of weeks, is all about the chemical stressors, which is the diet, basically what it is. And we didn't talk about the smoking, alcohol, but the idea is how can we improve our diet and kind of restore the gut function so we can, it will be a building block for the other stuff we're gonna do.
Absolutely.
Awesome. Any final comment, Crystal, before we go to the Q&As?
No, I think like we covered a lot in today's session, and I think, you know, the next steps that we've asked everyone to sort of focus on these next few weeks, there's a fair bit to kind of poke through. And so again, I just want to reiterate, you know, you pick the ones that resonate the most with you and you be really awesome at that for the next several weeks, several months. And then once you've mastered that, you move on to something different. So
Awesome.
Don't be discouraged.
Yeah, let me kind of unmute Jen and see if she has any questions. Jen, if you can hear us, yeah. Do you have any questions, Jen?
No, I think I'm good. I think I am good.
Are you overwhelmed?
No, not at all.
Awesome.
Nice.
We'll send it again. You're going to have the chance to review it. And if you have any questions, do you always let us know?
Okay, perfect. Thank you.
Awesome. Take care,
Amazing.
everybody. Thanks for
Have
listening.
a great night.
And we'll catch up in 2 weeks.
Sounds good. Thank you.
Okay, bye.
Amazing. Good night.
Good night.